Last August, then Governor Cuomo directed all healthcare workers would need to be vaccinated or risk termination. That order went into effect August 26th of 2021. In January, Governor Hochul expanded that requirement to include a COVID booster shot.
Since then, an awful lot of the CDC guidance surrounding COVID has been changed. And now Republican lawmakers in the state, they want to see that requirement actually dropped. 2 News Side's Nate Benson joins us now with that renewed push by lawmakers now, right, Nate?
Yes, Scott and Mary Alice, like you said, the guidelines by the CDC have changed. And with healthcare worker shortages, a big problem here in Western New York and across the state, lawmakers want to see change.
It's absolutely worth addressing, and we have to look at every scenario, every industry, and the overall impact on our state.
New York State Senator Ed Rath and his colleagues in the Minority Party caucus are calling on the CDC to provide new guidance that would ultimately allow healthcare workers that aren't vaccinated from COVID-19 to return to work. As of April 16th, 17,762 healthcare workers were terminated across New York State because they were unvaccinated. That's about 1.7% of the total healthcare workforce. Another 14,000 resigned or were furloughed. Here in Buffalo, ECMC fired 106 healthcare workers. 200 were let go at Catholic Health, and Kaleida terminated 300 people, about 5% of their workforce. All three health systems are facing staffing shortages.
Even the governor herself almost a year ago acknowledged the healthcare worker shortage. There's a way in which we can fix that, and that's by lifting these very difficult restrictions and regulations on vaccine requirements for healthcare workers.
2 on Your Side reached out to Governor Hochul's office to see if lifting this mandate was on the table. Hochul's office released a statement saying, in part, "We lost a lot of people who had been healthcare workers who were trained for this. They're concerned about their own health, their own safety ultimately, but the vast majority did stay." The state also reiterated its plan to spend over $21 billion on healthcare worker bonuses, increased wages, and new infrastructure in the coming years.
It's not surprising. New York State in many ways tries to solve many of its problems with financial incentives. Financial incentives, which I might add, could put us in a long-term financial difficult situation when our state budget has increased 20% over the last 2 years.
Rath says he and his colleagues are calling on the CDC to provide the guidance because unless Governor Hochul relinquishes her emergency powers, the legislature can't do anything.
Right now, in many ways, we are excluded from the process, and it's just the governor as well as her Department of Health. We need checks and balances, transparency, and accountability in government.
A spokesperson for the State Department of Health did make a point to direct me to state guidelines that show that a half a dozen other vaccinations are required for healthcare workers, in addition to the COVID-19 shot, those being the MMR, the flu shot, and others. In the studio, Nate Benson, Channel 2 News.
Hey, thank you.